All right, yesterday in a 53-45 vote, the Senate, in fact, confirmed Dr. Mehmet Oz to lead the Center for Medicare and Medicaid Services. So how does he plan on rooting out the waste, the fraud, the abuse, the corruption? He joins us now, his very first exclusive interview since being confirmed. First of all, you're a personal friend of mine. You're the right person for this job. I'm so happy you got confirmed. Democrats are idiots, but, you know, that was to be expected in the process. Why you gave up 500 businesses to do this, I don't know, but I'm grateful that you did. Can we clarify one thing first? Can you just get it out of the way? The president has said it to me. The vice president has said it to me. Others have said it over and over. The president has no plans to make any cuts to Social Security or Medicare, Medicaid at all, ever. End of sentence.
The president has said he will love and cherish Medicare, exactly what he's going to do. And I do want to thank the president for having the confidence in me to appoint me to this job of a lifetime. It is something I feel like I've been training for my whole career, practicing medicine. I went to business school, actually, so I learned to manage large groups. On the show, we talked about so many of the pillars of the Maha movement, and Bobby Kennedy, God bless him, has had the ability to push forward strongly on these issues as well. But the president knows something that's very, very important. All great societies, all of them, take care of their most vulnerable. And we're great people. So we're going to make sure that the young, the old, the disabled, the folks that are having trouble and need a hand up, we're going to make sure they're there. And when we need to be supportive of them, we're going to be able to get them back on their feet and get them to be part of the American dream, which is what the president is crafting. And I'm going to tell you, Sean, as a close friend, I tell the truth. Doctors are trained to give the story straight up. We've got some challenges, which is why the CMS programs are so important. The health insurance of our country is challenged by the fact that Medicaid is a #1 budget item for most states. It's challenged by the fact that our health economy, the amount of money we're spending on health care, is growing 2 times faster than the rest of the economy. In fact, we're paying twice as much per American to get health care than any other country on the planet. And despite that, our life expectancy has dropped. We're about 5 years shorter in life expectancy than our competing countries in Europe and the rest of the world. So with all this going on, there's a lot of things we've got to do to make a difference, and that's why I was honored to take this position.
All right, so we got that out of the way. Can we bring in innovative ways, new ways of thinking? For example, I know Atlas MD was created out of Wichita, Kansas. Access to a doctor anytime, 24/7, 365, and telemedicine is a big part of their practice. If you're sick in the middle of the night, you can get on a Zoom call with a doctor and probably get prescribed whatever you need. It'll be there in the morning, right? Or how do we drive down the high cost of prescription drugs for people? How do we do that? What are some of the strategies you think you can employ to save money and eliminate waste, fraud, and abuse?
Our country is too great for small ideas. So let me give you some big ideas, because you just touched on something really important. We have to empower beneficiaries, empower the American people. We're smart people. You give us the information. Tell me what I need to do to get healthier today. Help me understand what requires me to see a doctor. Help me find the right doctor. Make the appointment for me. And then tell me what it's going to cost, both when I see the doc, but also the treatments that I might get prescribed or offered during that visit. All this, by the way, the president in his executive order empowered Americans by insisting that we do that. It's one of the things that makes the American people #1 in the game plan that we have at CMS. I also want to point out, we got to take care of the doctors. We have a mojo problem amongst the medical community. Many physicians and nurses and practitioners feel left out of the story. Let's empower physicians and healthcare providers with information at their fingertips so they can provide better advice to you. Why let them have to figure everything out when we can actually pull together information and provide it to clinicians so when they're making decisions about your well-being, they can tell you exactly what they're doing and then share that information and why they're making it with you. But most importantly, Sean, these tactics, by modernizing American medicine, will allow us to deal with the waste, fraud, and abuse that you alluded to earlier. And let me give you some numbers. It's going to keep you up tonight. First off, just a couple right off this is right out of the oven, these ideas. And it's remarkable how many of these problems have persisted for years. Last year, we had 230,000 Americans who were on the Affordable Care Act, the Obamacare plans, who didn't know it. They found out when the IRS agents called up and said, you know, you guys have this free program in your family. Did you know you have it? Brokers had given them these programs, made money off the U.S. government. They had no idea it had happened. The state of California has taken tens of millions of dollars from the federal government, providing free health insurance for illegal immigrants in California. We're going to get that money back. Where there are programs like this that we're witnessing day in and day out, where Medicaid patients are enrolled in multiple states, and the federal government doesn't know about it. So we pay every state for the same person, and we're not getting our money's worth, but those people aren't getting their health either.
All right. One of the things, when I spoke with Bobby Kennedy, and he pointed out to me, and actually I spoke to you about it as well, the fact that Europe won't buy or take in our dairy, our meat, or take in our produce, that tells me there's a reason. What is the reason? And if they're not doing it for health reasons, should we change how we grow things, how our ranchers, you know, raise their cattle, et cetera?
You know, Sean, you can sprinkle the medication on a kielbasa, but eating the kielbasa is still going to make you sick. And in America, we actually do things to... Right, I do too. But if you've got a problem with your heart, it probably is not the best thing you put on your platter. We make a lot of foods that are on the surface healthy, but we've adulterated them. We've put products into them. We've mixed up how your biology deals with the complexity of the chemistry that they put in these foods. So you don't actually understand how to metabolize them. And it's one of the reasons I believe that this country is getting overweight and getting depressed and feeling out of sorts. The Europeans are not willing to take the chance. They block us from exporting products from this country to their country because they don't want their people eating those products. Bobby Kennedy believes we shouldn't be eating them here either.
All right, we gotta bring back health, wellness, nutrition. You know, Americans can get healthier. We can lose weight. We can reduce the number of people that have diabetes. We can look at why autism is at such high rates. Dr. Oz, appreciate you being here. Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.